Okay, now let's move on to the other half of this mind map, which is the progestogen-only pill section. So remember that this half of the mind map is in blue because it's supposed to represent or correspond with the color coding we gave for the progestogen, which was blue. So when you're remembering it and you're thinking about the parts of this mind map that are written in blue, think progestogen. Okay, so let's go on to discuss what it contains. So the progestogen-only pill, as it says in the name, contains very low doses of synthetic progestogen. So just for convenience, I'm going to refer to the progestogen-only pill as POPs and the combined oral contraceptive pill as COCs from now on, just because it's a real tongue twister. Okay, so let's look at this drawing. So unlike the COC, as you can see in this drawing, all the POP pills are pink. So this is meant to represent that they're all active pills. So with POPs, you have no placebos and no inactive pills, and you don't have to wait for 7 days in between taking your active pills. The nice thing about this is you can start taking the POP on any day. So if I get my pill on Monday, I can start on this Monday, or this one, or this one, or if I feel really wild, I can even start on this Monday pill. The reason why the days of the week are still displayed on the packaging is because, well, it's just for convenience and so that I can keep track of whether I'm taking my pill every day. The important thing to remember about the POP that's different from the COC is that when you first take it, when you take your first pill, it only becomes effective after 48 hours. So in this time, you have to use condoms or another form of contraception or avoid sex. So unlike with the COC, where you have immediate coverage, if you start taking the pill within 5 days after your period, and you have immediate coverage, in this case, you don't. You have to use another form of contraception for 48 hours. All right. So you might be asking, well, why would I want to use the POP and not the COC? Well, firstly, it's good for breastfeeding women. So remember that in the COC video, we spoke about how you cannot take the COC if you are within 6 weeks postpartum, if you plan on breastfeeding. So this is a great alternative for those women. Then it's also good for those who experience estrogen-related side effects, since the POP does not contain estrogen. And it's also good for all those other contraindications to using the COC, except for a few, and we'll get to those now. So, although the progesterone-only pill is considered pretty safe, there are a few contraindications. So, these are the following: severe cardiovascular disease, enzyme-inducing drugs like rifampicin and ritonavir, acute porphyria, current breast cancer, so not if you're at risk of breast cancer, only if you currently have one, since the progestogens will accelerate the growth of that tumor. And then if you're a perimenopausal woman, then you should also not take the pill, the POP, because it could increase your risk of developing osteoporosis. So because I don't like learning lists, of course I've developed another mnemonic to help you remember all these contraindications. So how it goes is POPs can't stop that pregnancy. Okay, so it's a little bit of a silly mnemonic. Mnemonic? I'm actually not sure how you pronounce that, but anyways, it's kind of silly, but hopefully it'll help. So the P in POP stands for porphyria. The C stands for cancer, so current breast cancer. The S stands for severe cardiovascular disease. Emphasis on the fact that it's severe because not all cardiovascular disease conditions or presentations will contraindicate you from using the POP. So I would assume you'd have to use your discretion as to whether or not that applies. Then with D, it's enzyme-inducing drugs, and with P, it's perimenopausal. So if you have any of these conditions, then POPs can't stop that pregnancy. Okay, I'm very sorry about that. Anyways, so now let's move on to what do you do if you miss a pill? So remember with COCs that we had quite a bit of leeway with what counted as a missed pill. With one missed pill, it meant that we were 24 to 48 hours late. So that's quite a bit of leeway that you have. Whereas now with the POP, a pill is counted as missed if you're more than 3 hours late. So what do you do if you're more than 3 hours late? You take your pill as soon as you remember, and then you take one pill each day as usual. So it's the same protocol as for the COC, except that you have to use condoms or avoid sex for the next 48 hours. So effectively, it's like starting all over again with taking your POP. So remember that if you are late for taking your pill, and in that time when you were late, you had unprotected sex, then you need to use emergency contraception because you don't have the same coverage that you would have had if you hadn't missed the pill. Another thing to remember is if you miss 2 pills, then again, use condoms. But if you miss 2 pills, then you just take the most recent pill and carry on as usual. It's the same as the protocol for the COC. Alright, so let's move on to side effects. So the side effects for POPs can be kind of summarized as either too much bleeding or no bleeding at all. So the first is irregular bleeding or spotting, which is the too much bleeding. Now, this is actually really common in people who use the POP. And it's important to remember that when your patient comes in complaining of this, you need to reassure her that this is completely normal and it does occur commonly in women who take the POP. It also should diminish over time, hopefully. And then managing it further would be the same as with the combined oral contraceptive pill. So again, you're going to exclude other causes, you're going to reassure, um, and so on. Now, another thing that I didn't mention in the previous video is that if a woman does come presenting with irregular bleeding or spotting and you suspect it's a side effect from the pill they're taking, then you should also maybe offer some ibuprofen, 800 milligrams 3 times a day for 5 days to provide some short-term relief. It's all very well to say, oh no, it will diminish over time, but what are they supposed to do in the meantime? They can't just grin and bear it. So this is what you can prescribe in the meantime. Then the next side effect is amenorrhea. So although it's not as common as the irregular bleeding and spotting, it's not uncommon in women who take the progesterone-only pill. And again, it's important to reassure your patient that it's not abnormal. And you should also, just in the back of your mind, you must think, well, what if their period has stopped because they're pregnant? So you'd want to do a pregnancy test. And if they are pregnant, you're going to need to manage them appropriately. And part of this would be opening the discussion of a TOP, that is a termination of pregnancy. Because if they are on this contraception, they probably didn't want to fall pregnant. So now that they are pregnant, it's important that you involve that in the conversation. Alright, so that's everything with our progesterone only pill. And here is our lady from the previous video who was very sad. And now she's very happy because she can finally use a form of contraception while she's breastfeeding. And she's very happy and she's crying tears of joy because now she doesn't have to have any more babies. So yeah, in the next video, we'll just be doing a quick summary on the differences between these 2 pills.